some goals in that line of area. So I appreciate the time today. Thanks for joining us during your lunch hour, and I will kick it back over to Rebecca.
Thanks, Michelle. So we are here to talk about the resources specific to behavioral health that are available to you, focusing on our digital and virtual resources, but we're adding a smattering of just the clinical bells and whistles. So we're going to talk primarily about self-directed resources, but I will also take the opportunity to mention some of our programs, some of our case management features, and we welcome questions along the way or at the end. So just to kind of contextualize a part of why we're here and frame up how Medica thinks about behavioral health and access. So I mentioned that my accountabilities are clinical in nature, and our network, right, those are providers that we contract with, that falls more on the operational side of the house. Our providers, however, support access to care, and then they provide the actual care to our members. So the intersection between clinical and operational is intimate. And I'm very passionate about this because behavioral health is so foundational to health. We'll talk more about that as we go, but easy access to the right providers at the right level of care in the moment that we're in is a priority for Medica, and we address that priority in several different ways. It's becoming more and more important in the world that we live in because what we're seeing is increasing need for behavioral health services. And we know that that points us towards increasing opportunity preventatively related to emotional health and well-being. You know, just as sort of a understanding of how normal mental health impacts are, we've got a statistic kind of kicking us off that acknowledges behavioral health as health, and that 20% of the United States population at any given time meets the diagnostic criteria for a mental illness. You know, that means that for people who have depression, for example, that there is duration and impact significance that creates a need for treatment. Although we also know that about 60% of people who meet that diagnostic criteria don't pursue or don't get treatment. And so we're just so honored and happy to be here to assure you that Medica knows how important behavioral health is and that we are always working behind the scenes to ensure that our members have a great network, great tools to support their use of that network, and great preventative tools to support sort of emotional well-being strategies that maybe help prevent the need for network use. So there are lots of words on this slide, lots of pieces, but the summary of this is that we have one of the largest, if not the largest, national network of available for providers across all levels of care for behavioral health conditions, both mental health and addiction concerns, or even substance use concerns. We have about half of our network has a significant sort of presence of virtual capability. So we know that half of our providers have virtual capability, but we also have a network growth strategy that means we are recruiting and contracting with all virtual providers. In some parts of the industry, you might hear the word virtual solutions. And we're going to talk more specifically about some of our featured providers. But we highlight that because generally speaking, all virtual providers have faster access to care. So most of our providers offer sort of a hybrid approach. And then we've got this group of about 50% of our providers that are all virtual, doing sort of access strategic availability work, you know, bells and whistles that support access to care. And we're going to talk about some of those too. So we highlight that to say we've got lots of different ways to engage in behavioral health services, And if you're open to virtual care or hybrid care, the likelihood that you get faster access to services is actually quite high. The other thing I just want to call out here is that we have some proactive ways that we support our members to think about their behavioral health. So at times, you might get a call from Medica, a case manager or a licensed mental health professional that just gives you a ring to say, hey, it may be of interest that we have a case management program that you're eligible for. Those are always voluntary. You never have to take our calls, but we always love it when you do. And we'll talk you through sort of what the case management function is. You will be introduced to a single point of contact that can help talk you through benefits and access supports, and just kind of work with our members in the moment that they are in for those that opt in to case management. So you can find providers or find services through us. And we also might occasionally outreach to you to just remind you that we're here and that your health plan is your partner in your health journey, and that we've got a tool bag of resources available that we can make really easy for you through the case management process. And then finally, I'll just say, every time we do a presentation like this, we invite your feedback. So you're welcome to give us feedback directly. You're welcome to think of Michelle and I as resources. You can email us, or you can talk to your HR department and ask them to give us feedback, right? There is a relationship between human resources and the Medica account teams so that we know that we're meeting your needs. If there's something we don't have in our suite of services that you're looking for, that's great information for us. If we do have something and you have a particular experience you think we would want to know about, good, bad, or otherwise, that's so helpful. It helps us evolve what we offer and evolve our efforts to ensure we're always meeting our member needs. So hear this as an invitation. Let us know how we're doing. Some specific pieces about our network. You can see that we've got moving into 500,000 providers across the national network. That's important for our members. So we know that we're talking to membership primarily in the Midwest, mostly in Minnesota here, but maybe you have kids in college or dependents that live somewhere else in the United States. So that network of providers across the nation really makes it easy, no matter where you are, to access a quality behavioral health provider. We call out some of the specific specialty providers just to assure you that if you need medication support around addiction, alcohol, or opioids, if you need specialty pediatric care like autism care through ABA or another specialty type provider, if you speak a different language or are looking to be supported by someone who understands your cultural experience, we've got all of that available. We're here to talk about digital and virtual support, but I do want to just give a shout out to that number you see at the top of your screen, that 800 number. That's our call center. It's a full service call center that really works to support our members, connect our members. There's no wrong reason to call Medica Behavioral Health at that 1-800 number. So if you're running into any sort of thing that's just too labor intensive, too confusing, you just want some efficiency in your life, go ahead and give us a call. So on that first slide, I talked about case management, and I'm just going to walk you through the specific types of case management supports that we offer. I'm also going to speak to when we might call a member, and I'm going to reiterate the invitation that members are always welcome to call us at that 1-800 number and explore case management to determine if that might be a good option for you in the moment that you are in. So on the right side of my screen, as I face it, there's a dark blue square, and that describes all of the case management program types that we have. So anytime a person is hospitalized for psychiatric reason or a substance use reason, we do an outreach both to the hospital to ensure that the hospital social worker or discharge planner knows about all of the access benefits, all of the in-network providers we have available. And, we just offer to partner with the treating provider to ensure that they are working with your health plan and leveraging everything you have available to you to support your progression in recovery. We also try to reach our member. So before you're discharging from the hospital, you might get a message or a call from the health plan that says, hey, we're here. If you've got any questions, if you've got just a desire for a little extra support, a point of contact who is a licensed mental health professional to walk you through next steps, to answer questions about bills, to help you find another provider, or just to be a resource as a person moves through that inpatient experience to outpatient care. Having that trusted person that knows you, that knows your health plan, and that can act as an in-between can just really take pressure off a person. So there we work with a provider, and we might outreach, or we do actually outreach to members. As always, a member can say yes or no. We might leave a message. We'll write a letter if we haven't heard from a member. And a person is under no obligation to respond to that. But when you're interested or feel like it would be helpful, we're there. We also have a case management program that supports people that have primary physical health conditions, chronic conditions like diabetes, high blood pressure, new diagnoses that can be really shocking or hard to adjust to or to even get one's head around. Sometimes those kinds of things are very emotional and also like a lot of work to manage. And so we may outreach to our members who have significant physical health things going on to say, we're here to offer some emotional support, try to streamline the process, answer questions, make life a little easier. And we also want to acknowledge that sometimes there are mental health and even substance use impacts when we're going through big life health moments. And so we might walk a person through what might be happening for them on the behavioral side as they're also going through this physical health journey. So that's our medical behavioral integration case management function. We have a pediatric specialty program, and I'll speak to that more because we have a separate slide specifically to that. It works a little bit differently than our other case management programs. And then we also have an intensive case management program. It's telephonic, but we have a community-based partnership for our members that live in Minnesota so that if face-to-face case management is really going to work better, then that is an opportunity that's available to our members. This particular case management program addresses pretty intensive behavioral health needs. So if it's hard to stay out of the hospital, those symptoms are just really disrupting day-to-day life, interrupting work, interrupting school. There's lots of visits to the emergency department, perhaps. Maybe medication isn't working like it's supposed to. And so there's just really a sense of instability and lots of unknowns. This is where that case management program comes in handy. Usually people work with the case manager a little bit longer because the course of recovery can be longer and more complicated when there's just lots going on related to mental health and substance use, or one or the other. And there is no end date to that, right? We really stick with people until they don't need us anymore, which is a nice case management type service. This slide specifically calls out some details about our family support program. It's our pediatric case management program. We encourage our members to self-refer to this program because we know that navigating the children's mental health system, even for small things, can be very overwhelming and complicated. We also know that children's mental health is often very integrated into the pediatric world of physical health, right? Most mental health observations start in a pediatrician's office. And so we have specialists that have pediatric experience. Again, they're licensed mental health professionals. They know a lot about child development and can really help families across all diagnoses support their children as they navigate the mental health system. And of course, we also work with kids and teens who would like their own case manager directly. But we, by and large, find that parents really appreciate having a pediatric expert as it relates to navigating that mental health system and just having the ear of someone who understands what that's like and can connect people to resources around helping in moments where help is just really needed. So you can see that there's a number at the bottom of the screen. It's our call center, and you can call and say you'd like to talk to someone about the family support program, and you might be directed to a voicemail to leave a message, but a case manager, care advocate case manager will call you back. Is there a question that came in there?
Hi, Rebecca. Yes, there is a question. Caitlin wondered, these are all options in addition to their general care coordinators?
So these are, yes. So care coordination speaks to sort of a general navigation process for commercial members. And very often that's offered like by the provider system, but sometimes the health plan will offer that too. And so these cohorts are more specifically tailored to behavioral health needs based on that piece that I spelled out. But there is a very general behavioral health support function. So if someone doesn't have a pediatric specialty need or a chronic medical condition, or they're not just coming out of the hospital, but there's still a behavioral health need, we've got that available too. So yes, thank you for the question. Okay. I wanted to take just a second to talk about a few access tricks that we have. So we have reserved psychiatry appointments, primarily for our Minnesota membership. And we also have urgent care appointments that work a lot like those reserved psychiatry appointments. So we kind of think of them as one program to support our members to get access to care. Reserved psychiatry operates primarily in Minnesota, where the most of our membership is, and we've got some special relationships with providers to offer virtual care psychiatry within 2 business days. Urgent care is the same program, but it's nationwide. So for our members that don't live in Minnesota, we have the same speedy access to care. And really the idea behind this is that you would have access to a prescriber, possibly a therapist, through the urgent care function, who's got speedy availability that might help you avoid an emergency department visit or answer questions that are not able to really wait a month or more for a standard outpatient appointment. Or sometimes even the providers that we are established with don't have availability in the amount of time where, you know, it would just be so helpful to see someone. And so that is our urgent care function. And so you don't need to worry about if you should ask for an urgent care or a reserved appointment. You would just call the number on the back of your insurance card, which is the same as the number throughout this deck, our 1-800 number, one-stop shop call center. And you would ask for urgent care support. We have a dedicated call center. It's the folks that answer those phones are very well versed in our benefits, and they're going to understand what you mean when you say, I have an urgent care need or I'd like a reserved appointment. So the language doesn't matter. But you'll call, you'll make that request, you'll be connected to a licensed mental health professional, right? This is someone qualified to hear your story, to understand what is happening and to partner with you related to what is the best next step, right? And your thoughts, your experience, your knowledge of yourself, your dependent, whomever you're calling about, the subscriber, is really what's going to drive that next steps conversation. So it's truly a partnership where you've got a mental health professional who's with you, who's doing an assessment, and who's helping you think about the options that are available to you. And of course, they will make a recommendation which you can accept, or you can talk them through kind of what you were thinking. And then finally, if an appointment within a day or two is what is going to meet the needs of the caller, of the member in that moment, you'll be supported to make that appointment right then and there. So it's just such a slick service that kind of bypasses traditional wait times in a environment where there just aren't always enough providers. Michelle, anything to add on that? Did I miss anything?
No, I think you covered it. I would say, I don't know that we mentioned, but the number is available. Our call center is open 24/7.
Thank you.
Calls, so.
Yes, anytime. All right, and I wanted to also highlight a few of our relationships with online specialty groups, right? So we've got lots of virtual providers, as I mentioned earlier, but some of our virtual providers offer a very specific type of service. And because Michelle is going to walk us through how we use our directory, we wanted to make you aware that within the directory, there are some really helpful provider specialties represented where their access is, because they're all virtual, their access is more streamlined from our provider platform. So Bend is a full service child and adolescent mental health provider group. And what I really love about Bend is that they're integrated. So they can help with some physical health needs. They can help with some basic testing, ADHD specialists, for example. And then they have just general mental health standards of care, or, standard care. So psychiatry, therapy, they offer traditional outpatient, and they also offer more intensive programming. So that's kid specific, but supports the whole family, and is just a really great model of care. Along with that, I'm going to mention Brightside and Charlie. They're more broad and offer adolescent care specific to mental health. I think Charlie also supports co-occurring substance use concerns and mental health. And Charlie Health also has IOP level of care available. But on this slide, Bend, Charlie, Brightside are basically our child and youth options. We've also got Equip, which is an online eating disorder provider group. This is relatively new in the behavioral health landscape. Treatment of eating disorders all virtually. And Equip offers standard outpatient care specific to eating disorder needs, all the way up through intensive outpatient care. So that is also just a very beautiful option for members where getting to an IOP is prohibitive, or where getting out of the house is just not something that's going to happen. If a person is available to treatment and can access it virtually, an intensive treatment option online can be a very beautiful access support. Talkspace is a general mental health, all virtual provider. And we like them because they offer such a curated find a provider experience, right? They'll ask you a few questions about yourself. It's a really nice digital interface. The graphics are lovely. And then they offer you 3 providers at a time based on what you've told, the interface, based on how you've answered the questions. And so it's just more curated, less overwhelming, and they're really working to pair you with a provider that is going to feel the best for you. And they also make it really easy to change providers. So if you start with someone and fit doesn't feel quite right, then they create just a very easy way to try someone else. And we feel like this is just really a big deal, because the relationship between the provider and the person when it comes to mental health or substance use care is so important, right? It's so important to recovery, because you've got to be your most authentic self. And a lot of us are not comfortable putting those things on the table with a new provider when it doesn't feel right. We are very vulnerable sometimes in mental health care. but it's the best way to get the best treatment and the speediest and most effective recovery. So that relationship really matters, and we love that about Talkspace. RIA Health is a online provider that focuses on alcohol use. We also love this, and we certainly know that nationally alcohol use and drug use is increasing. We know from claims utilization that alcohol use is increasing more for Medica members. And so RIA offers an online platform, which for some people is just going to be better than going to a provider to talk about how maybe they're just using alcohol differently than they used to and differently than they want to. So we're very happy to have them as a part of our virtual strategy. And finally, Talkiatry. We mentioned them because they offer a pretty deep breadth of prescriber functionality. So for psychiatry or nurse practitioners that are offering prescription and medication management, that's a nice virtual option. And they do some substance use support as well. Okay, I'm 2 minutes over my time. So let me hand it over to my colleague, Michelle, to go deeper into our self-directed resources.
Rebecca, there was one question about our members referred to those programs through the call center professionals. And I think the answer is you can go direct. You can call these facilities and let them know your member information, or when you call in, you can have a consult and talk to that representative, and they may bring one of these up. They'll provide you with options, and one of these providers may be in that list.
Yeah, and we'll talk about how you can find these providers on our Find a Provider directory too, just by searching their name, and that'll give you their number.
Right. Thanks, Rebecca. So now we're going to shift to some of the digital or online services and capabilities or resources that are available to you. Rebecca mentioned we thought the first would be the provider directory. This is a great place to start if you're looking for a provider. There are a number of features and functionalities to help you find someone to meet your specific needs. Just a few of the things listed here. You can search by name, condition, expertise, specialty. I've got a few more slides that have screenshots of the detail that I'll go into. Other pieces of information that are available is there's cost estimates by geography. You can also log in to get them specific estimates specific to your plan. There's this, you can email or go direct to the website from the directory. There's also filters to allow you to find the virtual providers and that have the availability. And then there's patient satisfaction information. So we can go to the next slide. Thank you. So accessing the directory, we do have a few ways in just to help direct members to the right place, depending on where you're coming from. You can get to the directory by signing into your Medica member portal. Most commonly, people are going in probably through our public site without logging in is another option. So that's what this visual is. Again, as Rebecca mentioned, we have 445,000 plus providers nationally. So there's an extensive network that you can access. When you go to medica.com/findcare, you'll see a list of plan options, and you'll select the plan that you're enrolled in, the plan name, and then you'll see, you can see on the little tile that says behavioral health, and then you'll click start here, and that will immediately bring you over to the directory that publishes results. In some cases, you may have to put your location in, but in most cases, it'll pick up your location and autofill that. But you may have to put your location in first, and then you will get a list of results before you even type anything else. And one of the things that the vendor that supports this directory found is that people didn't often know where to start. And so it presents the most common care categories with results right away. And that those categories are stress and anxiety, family and individual or family and therapy and counseling services, and then substance abuse, substance and alcohol abuse. So those three categories have provider results in them. And then you can you can type in the search. You can see the search bar a little bit right there that in the screen there. You can change your location or type a name or a condition to change the results right there. Or you can click view all and then start using some of the refining tools to dig deeper and curate your results that will better meet your needs. And then I mentioned also there's a live and work well. I have we'll talk about that in a few minutes as well. But if you're going through that resource, you can also access the directory there. So I mentioned there's extensive filtering options. There's over 70 plus filtering options. From this screenshot, obviously you can't see all of the options in there. Some of them have the drop down, but the little tiles in the middle there, I guess they're referred to as chiclets in some places. I don't know. I haven't used that term, but they have options to filter down your results, and you can find evening and weekend appointments. This is where you can filter for virtual visits, age treated, language, ethnicity, so many more other options. You see a little bit under area of expertise. This probably has 60 plus options, filtering options, but you can see these are some in the A category: abuse, adoption issues, anger management, anxiety. The other piece I want to call out here is there's an option to identify providers that have immediate upcoming scheduling capability. And you can filter by 1 to 14 and 30 days. I will say these are providers that are using the scheduling platform within the directory. So this does not mean these are the only providers that may have availability within that time frame. It's just these are providers that we have access to scheduling information, and you can log into the directory then and schedule and use a scheduling feature to schedule with these providers. And then the other piece you can see is average cost estimates. It's pretty small, but it's on that right side. It's green, and you'll see it how it's compared. There's $3 signs, and it highlights where they compare regionally. Slide, Rebecca. Oh. All right. So behavioral health, telehealth visits. We talked a lot about this, and just wanted to call out again, using the directory to find your options. There's a filter. You can find virtual only, virtual and in-person, or both, and it will filter your results. You can look for providers in the results that have a little button that have a schedule online feature. And those would be the providers that are on the platform. And you can click on that, and then you can launch right into the scheduling option. And what it does is it'll present a few options for you as well. If the provider isn't available right away, it actually prompts and puts 3 or 4 more provider options in there that you can click on. It works pretty slick. And we're going to move along here because I see it's about 10 after 12. So the other resource is a Self-Care by Able2 app. It provides on-demand support for stress and emotional well-being. It's designed to help members identify their negative thoughts and learn behavior to change those and spin it so that it's a more positive thought process. There's a variety of different tools and coping techniques, meditations, and we'll go through those probably very quickly. I've got a couple of slides. It's available to members 13 plus, this self-care part of it. There are 4 categories basically where the resources tools are kind of organized by. There's assessments and tracking, mental health skills and tools, collections, and community. And if you want to jump ahead, Rebecca, I've got a slide on each one to break it down a little bit more. So assessments and mood trackers, this mood tracking is a great way for members to for individuals to understand where they are, identify certain triggers, and that's kind of the first step in understanding how to make changes or manage those or change those situations in order to have a more positive, resilient outcome. And, tracking over time will help you to do that too and identify just certain areas. Mental health skills and support. This is where the meditations you can find habit tracking and journaling. The piece I like about the journaling is it's 3 C's, and it's catch it. So the first step is to identify those thoughts, and then it's check it. So question if the thoughts are flawed, or are you overthinking, or are they unrealistic? And then the third one is change it. So reframe that thought, and it prompts you through and gets you to, it's a great exercise and resource. And then all of these things, when you're interacting with the app, it does change what gets prompted on your homepage and the content that might be appropriate for you, just based on the goals you're setting and your assessment and your engagement, the way you're using the app. And then collections, it's curated content. So it takes a topic and it has resources and interactive videos and articles, and it pulls together different parts of the app and puts it under one place that's related to that topic, so that you don't have to kind of bounce around the app. And it, for example, meditations are available in a different section, but there might be a meditation linked to one of these collections that would be appropriate. The community are daily, weekly prompts where it posts a question, and the community that's using the app will respond. And it's just a really nice, positive way to learn from others and how they're coping, dealing with things, what tricks and tools they're doing. And then this is some information about getting started. We won't walk through this. Like we said, we will leave the deck, so I don't need to walk through this. But basically, you do want to start at the begin, able2.com begin. When you register and get the link to the app, it's a little bit more seamless process to connect your insurance part to the app. So that is a good way to go. The app also has access to schedule online therapy. So this is a step-by-step on how you would access the online therapy piece of it. The online therapy is available for 18 and older. It's not available for the 13. The self-care, the self-directed resources are available for ages 13 and up.
Michelle, I'd like to say just one more thing about Able2 and the app and using the therapy function, if I could.
Yes.
So Able2, the self-care app, is built on cognitive, behavioral, theoretical concepts, right? It's a therapy modality that is evidence-based, and a lot of therapists use cognitive behavioral strategies to treat conditions like anxiety and depression, and more than that as well. But those are very common approaches for those conditions. And so an Able2 app or an Able2 therapist is very likely to use the Able2 app with their members that they are supporting in a therapy way. So it's a really nice complement to have the app and to be working with an Able2 therapist as they go through sort of the treatment process related to depression and anxiety. The app can be a really helpful tool to support that therapeutic work. So it's a nice partnership, I guess, between digital and clinical. Thanks, Michelle.
Sure. Okay, I see we are just about at time. I know we're recording, so we might just run through this, and it sounds like we can send the recording out. So we'll just kind of continue on. And this outlines a little bit what to expect with the Able2 and the online therapy scheduling. It's providing short-term skill-focused therapy. As Rebecca said, I think it engages with the app when you're working with a therapist through Able2. They are part of the Behavioral Health Network. So it is covered under your plan, under your behavioral health benefit. Members, again, must be 18. An initial session is about a 60-minute consultation where they set up a personalized plan. They usually will recommend often an 8-week program, and they are weekly 45-minute sessions. But you can adjust as needed. You can move ahead. All right, so the other resource just wanted to call your attention to today was Live and Work Well. There is a ton of information out here, all sorts of resources and content and tools, and just to help with a variety of different resources. it's just family, financial, navigating, understanding your therapy options, just a whole host of things. There's also more detailed information about substance abuse, the call lines in there, some tricks for accessing that. And then this is just another screenshot. So when you go in, you can go in through the medica.com member website. And in January, there will be a direct link where you won't have to log in anymore. Right now, you still need to use the Medica access code. And to get the personal information, you'll have to log in. But after January, that should be a streamlined process through your Medica member portal. So you won't have to do that anymore. There are just a few screenshots again, information on stress, depression, family concerns, financial fitness, parenting. It's good to explore. There's these self-guided video courses that are broken up. There's their lessons are identified. There's a trailer. There's an overview of what each session entails. Explore therapy talks about the different kinds of therapy. There's a family support navigator, kind of supports not the call number, the case management, but it's an online tool that you can answer questions, and it will help you with a plan for children with autism or depression. And then there's a guided help. You can also do that and fill out some questions. And then one more item here, I would be remiss to not say My Health Rewards, the wellness platform. I know you've had other webinars about the resource, but just wanted to put a plug in here that there's also journeys that are focused on the mental health support. All these things, stress, eating, finding balance, sleeping, all impact your mental health. So these are great tools to just have in your back pocket and available on demand. And then we just put how to access that. Again, I know you've had this information, maybe some of you before, so just wanted to have it all in one place, easy access. So that was fast. But any questions?
I would just say this is the most comprehensive
Sorry, we went a little
overview of all of our mental health programs I've ever seen. I think this was amazing. So thank you.
Oh, thank you.
Thank you. I'm so glad. Let us know what else you're interested in. We want you to use your benefits.
Yeah, this is great.
Thank you so much.
Right.
Yes, thank you so much, Rebecca and Michelle. If we don't have any other questions, we'll wrap up. Thank you again for all this terrific information. Everyone, we will be sending out a recording as well as the link for your 500 points for My Health Rewards. So that's a good thing.
Great.
Thank you. Have a safe, happy, and well holiday season.
Yes.
Take care.
Thanks.
Bye.
Thank you so much. Bye-bye, everyone.
Bye.
Bye, everybody.